The suicide earlier this year of chef and travel host Anthony Bourdain shone a spotlight on this mental health issue. September is Suicide Prevention Awareness Month, and one key demographic at heightened suicide risk are teenagers. OU Physicians child psychologist Dr. Swapna Deshpande is joining me now with a wake-up call for families. We appreciate you being here. This is such an important topic.
Thank you. Thank you for having me here.
Yes, we're glad you're here. Well, how common are suicidal thoughts in teenagers and older children?
You know, it's very common. According to a big national survey done by the CDC of almost 15,000 high school students, they found that 17% had actually seriously thought of committing suicide. So that's a huge number. And about 7% had actually made an attempt. So those numbers are really staggering.
For 7% of teens to make an attempt, that is a very large number. That is very scary. And also we saw that suicide is increasing 1% to 2% per year. That too is scary. So this of course is something that all parents should be aware of, especially with online bullying being such a big thing now. A lot of people have suicidal thoughts just because of that. But what are the common myths that people might have about suicide?
You know, sometimes people think that once you're suicidal, you're going to remain so all your life and you're really committed to dying. That's a huge myth. Suicidal thoughts are transient, they are situation specific. You know, I cannot tell you how often I see a patient in the ER and they have lost their phone privileges and that is the trigger. So really things can be really as simple as losing cell phone or conflict or breakup. So they are really situation specific. These thoughts are not permanent, and when they are present, they are usually ambivalent. They are not sure if they really want to die. So if they are supported during that crisis, they really don't go on to committing an attempt or suicide.
Right, and it's over such trivial things like phone privileges, like you mentioned, things that teens aren't aware that these too will pass. It's not a big deal, whereas families, if their loved one committed suicide, they have their lifetime of never healing.
That's
such a
true.
painful thing. What are some of the treatments that teenagers can have in the very beginning when they start to have suicidal thoughts?
There are lots of treatments that are available. The treatments that are available can be counseling, psychotherapy, it can be medications. So psychotherapy treats the dysfunctional negative thoughts and turns them into positive, or helps the patient or the child turn into positive thoughts. As far as psychiatric treatments, and I'm a psychiatrist, so as far as psychiatric treatments, we have lots of medications that are options, and common medications that we start with are called SSRIs. They actually change the level of serotonin in the brain. So that's one of the mechanisms we think that helps with depressive and anxious thoughts.
Okay, and we have about 30 seconds left, but I want to get to something that you say is a safety plan. It's called My3. Tell us about that.
Well, My3 is an app that's put out by the National Suicide Foundation, and it's an app that you can have on your phone, and it has everything built into it. You build it on your phone because you know phone is a lifeline. So for teenagers, it's a lifeline. So it has a list of contacts that you can call. It has the National Suicide Hotline. It has a list of reasons for you to remember in that crisis, crucial moment. Because the window sometimes is as short as 5 to 10 minutes when you're really going to do something.
Yes.
And there are some list of coping skills that you can use to distract yourself in a crisis. So that app can be really helpful.
Yes, I appreciate you telling us about this. This is such an important topic. Again, September is Suicide Prevention Month, and we appreciate you being here. Thank you very much.
Thank you. It's my pleasure.
Well, on to other news. A good meal is not